Well, our main role is to coordinate very closely with the Ministry of Health the health needs on the ground and to respond to those health needs. At the moment, we have received requests to coordinate the deployment of emergency medical teams and of trauma supplies and trauma kits. So we are looking into that. We are also working with authorities to get a better picture on the priority needs, on the damage assessments on the ground, and coordinating very closely with our health partners to move a collective response. Well, at the moment, the focus is clearly on search and rescue. It's injuries that need to be treated, first aid response of communities on the ground, and then more specialized trauma care in hospitals. While we have severe weather on the ground, it's freezing cold, it's cold temperatures, so the risk for infectious disease, apart from the immediate risk for trauma and injuries, is definitely increasing as we go along. Also, as some of the critical supply lines, water and sanitation, will be compromised. Infectious diseases is certainly a big risk. Then also the risk for mental health and psychosocial support that is required to be addressed. There is a massive, obviously, psychological trauma apart from the physical trauma that needs to be addressed. Well, particularly in those vulnerable population groups, we see a high level of mental stress, of psychosocial support needs. We also see, obviously, trauma needs, but then also those people are in risk of infectious diseases, so we need to strengthen the early warning systems to prevent outbreaks and to respond to infectious disease risks more consolidated, concentrated. That need to be treated. Well, Turkey has massive capacities and massive experience. They have the UMKE teams that have embedded medical capacities in search and rescue. We also have worked with Turkish authorities to improve earthquake resilience of hospitals, to ensure that hospitals remain functional after such shocks and earthquakes, and to jointly do trainings and capacity building, and also to share Turkish experience with other countries. But now Turkey needs the solidarity of other countries to address the massive challenges of this big disaster. Well, at the moment we are looking primarily at trauma kits, that is surgical kits to help with surgical interventions to address the injuries. We are mobilizing medicines. What we also often see is then chronic disease. Medications might be in short supply, and we are also mobilizing experts to help with addressing early warning and surveillance systems and to coordinate the broader response of the health cluster and health partners on the ground.